All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Hello dear friends, good evening. Welcome to BMC Global Lab, Al Hilal Health World, nothing but lifestyle. As you know, this is a talk show exclusively with the expert doctors of Al Hilal hospitals and medical centers. In a global effort to raise awareness on breast cancer, the month of October is designated as the Pink Month. And we are delighted to have with us Dr. Krishna Kavita Ramavath from Al Hilal Hospital, Manama. She is one of the top rated obstetrician and gynecologist in Bahrain, and she comes with an experience of more than 28 years. And her area of expertise include gynec oncology. So doctor, welcome to the show and thank you for joining us today.
Thank you for having me in the show, and it's a delight always to be here.
Yes doctor. So let's start with, what is breast cancer and what is the importance of knowing about this disease now?
October is a month of breast cancer awareness, as you all know, and it's a time to honor the survivors and also remember the loved ones and educate ourselves about how to prevent from breast cancer. When you see the global census, the incidence of breast cancer has been increasing. In 2020, the cancer statistics has said that breast cancer stood out second among all the cancers next to lung cancer. And the global incidence is that about 2.26 million women are diagnosed with breast cancer, and the incidence has been rising. When you look at the GCC countries, Bahrain stands highest among breast cancers, and 52.3 million women have been diagnosed. So since that is the alarming statistics, we have to make sure that what are the risk factors, we should know how to prevent them, and also what are the important screenings that are necessary for the women to protect themselves from the breast cancer.
Now, doctor, can you please explain about the early signs and symptoms of cancer, breast cancer, for our viewers?
Yes, like any cancer, breast cancer signs and symptoms are very much easily diagnosed. So women should often look for any signs and symptoms of change in the size and shape of the breast, or any lump which is felt in the breast or under the axilla, or they can check for any redness, scaliness, or any discharge from the nipple, thickening of the skin, or any pulling pain from the breast. So non-cancerous lumps are very small, they are globular, and they are easily mobile, and they are painless. But a suspicious cancerous lump is hard, irregular in shape, and it is fixed, and pain is one constant feature of breast cancer.
Now we would like to know about the risk factors associated with the breast cancer.
Like many cancers which have risk factors, breast cancer also has risk factors. Like among all the risk factors, being a female itself is the biggest risk factor, because females have the breast tissue. And age, advancing age is also a risk factor. Women above 50 years, they have higher incidence of breast cancer. Also, having a family history of breast cancer. If you have a family, a first degree relative with a breast cancer, like a parent, a mother, a sister, or a brother, the risk of having breast cancer doubles. If you have two first degree relatives, the risk triples. Not only the family history, but having a personal history of breast cancer, or having a radiation to the chest at very early age because of any second cancers also increases the risk. Diet rich in saturated fatty acids, sedentary lifestyle, or women taking oral contraceptive pills or hormone replacement therapy postmenopausally, which increases the estrogen content, can also have a risk of breast cancer. Hereditary cancers are only 10%, but most cancers are sporadic. So lifestyle factors are very important. Apart from that, lifestyle factors, the breast cancer is also seen in women who have alcohol intake or smoking. Women who smoke, they also are at increased risk of breast cancers.
Okay, doctor, I have read that stress is a factor that leads to some of the cancers. And what is your opinion about breast cancer?
Yes, stress is also a risk factor in having a higher incidence of breast cancer. Women who are at increased stress with life events or work pressures, or those who are smoking or taking alcohol, all these women have increased risk of breast cancer. So researchers have theorized that melatonin is a protective factor for breast cancer. So there is an interesting study published in British Journal recently. They said that Norwegian scientists have observed, and they have done a study on around 15,000 blind women, and they have followed them through their stages of life, and they have come out with an interesting feature saying that blind women have 50% reduced incidence of breast cancer. And the reason is that blind women have no light reflex, so they have increased levels of melatonin. So melatonin added as a protective factor for them. Hence, they have also studied women who have night shifts, who are working for long hours in the nights and exposed to the night light. And those women who are not able to sleep, where the melatonin factor has increased during the circadian rhythm nighttime. So these women with insomnia also have increased risk of breast cancer. So circadian rhythm disruption can also increase the cancer risk. So likewise, stress factors definitely increase the breast cancer risk.
Okay. So when we say about breast cancer, the word which comes to our mind is mammogram.
Correct.
So our viewers would like to know more about mammogram. How often should a woman go for mammogram and around what age? Can you explain in detail?
Mammogram is the primary non-invasive tool for screening in breast cancers. So it uses low dose X-rays to screen the breast lumps which are not diagnosed by the ultrasound. And a screening test means we are doing a test before the signs and symptoms develop to identify the lump or a disease in a very primitive condition, so that the treatment is very easy and early diagnosis is best for the treatment. Likewise, there are American College guidelines saying when women should undergo mammograms. So from the age 40 to 44, it is optional for the women to choose mammogram, but from 45 to 54, American College of Obstetricians and Gynecologists, they say that women should undergo annual mammograms. From 55 to 65, every 2 years, once in 2 years a mammogram is enough. But after that, until 10 years, it's optional whether to go for the tests or not. This is for the low risk women. But for the women with high risk, that is women having a family history of breast cancer or a genetic BRCA1 BRCA2 mutation or a personal history, they will have a mammogram plus MRI annually, and that is indicated by the American College guidelines.
Now, can you please give us some ways to lower the risk of breast cancer?
Very importantly, prevention matters. So, lifestyle modifications come as a first and foremost factor in preventing breast cancer. So, a sedentary lifestyle, if it causes breast cancer, the opposite of it is activity, exercise, and diet rich in fruits and vegetables. They say that Mediterranean diet is best, which has lot of salads, fruits and lean meat. So, that diet has to be consumed. Apart from diet and exercise, screenings are very important. So, women should never forget to go for their annual screenings. A breast ultrasound or mammogram saves lives. Actually, they say that getting a screening mammogram cuts the breast cancer risk up to 40% dying from breast cancer. So, it is scientifically proven. So, you should never miss getting a mammogram screenings.
So, doctor, we know about self breast examination. Can you make it more clear for us?
Self breast examination is a very important way to diagnose the breast lumps. So, women usually can do it once in a month, especially post menstrually, because when those breasts are less lumpy and tender at that time, women can check the breasts in a shower or after a shower. So, all they have to check is to see for the change in the shape and size of the breast, or if there is any thickening of the skin or any lump which is felt inside the breast or under the axilla, or any discharge from the nipple or redness or scaliness of the nipple. If you find such lumps, it's very important that you reach out to the doctors, because 8 out of 10 lumps are benign, but the doctor has to confirm that it is a benign lump. So, it's important that you reach out to the doctor so that the doctor checks you up.
And now we know that genetic factor plays a role in the transmission of many cancers. And what about breast cancer?
Yes, genetics also play a role in breast cancer, and about 8 to 10% of breast cancers are genetically inherited. But 80 to 90% are sporadic or random cancers. So BRCA1 and BRCA2 genes are implicated in the breast cancer. These genes are tumor suppressor genes. Everybody has BRCA1 and BRCA2 genes. So what if everybody has a BRCA genes? How are they implicated in the cancer risk? So each of us get a copy of a BRCA1 and BRCA2 from each of our parents. But since these are tumor suppressor genes, the question is whether it's not whether you have the gene or not, whether this gene is working or not. That's more important. If the gene is working properly, then you have the ability to suppress the tumor. But if the gene is not working properly, or if there is a mutation in the gene, that female has highest risk for breast cancer or ovarian cancer. So in a female with a mutant BRCA1 and BRCA2 gene, the risk of breast cancer is about 80% and lifetime risk of ovarian cancer is about 40%. So it is very important that you have to understand the BRCA genes, and if you have a question that if your family member has been affected with a breast cancer, it's very important that you reach out to a genetic counselor or a gyne oncologist who can help you and advise you and talk to you about the preventive measures.
So if a woman is tested positive for the genetic factors, what are the options?
Right. So a genetic test, if a woman is positive for BRCA1 or BRCA2, a positive test means this person has increased risk of inherited breast cancer. A negative test also doesn't mean that the person doesn't have risk of breast cancer, because it's only 8 to 10% are inherited breast cancers. Rest of the cancers are sporadic. So when the test results come as positive, again it's very important to discuss with your doctors, because there are various options to decrease your cancer risk. First and foremost thing is screening and surveillance. If there is a family history of breast cancer and you are tested positive for BRCA gene, then your screening will start very early. If in normal population screening starts at 40, in your condition the screening starts at the age of 25. So you should visit the doctor. So the screening could be ultrasound and mammograms, both combined. And mammogram plus MRI is also done with a family history. Not only the screening, again you also have risk reduction surgeries. So you must have heard about the American actress Angelina Jolie, yes, who has removed her breast prophylactically. So it's called risk reduction mastectomy. Angelina Jolie's family has a high risk for ovarian cancers, and when she was tested for the BRCA gene, she turned out to be high risk and positive. So she removed her breast prophylactically. So BRCA genes have actually came into fame once this situation has happened. So risk reduction surgeries are done once your families are completed. After the age of 40, women can undergo prophylactic mastectomy, that is removal of breasts, or prophylactic salpingo-oophorectomy, that is removal of tubes and ovaries. So in this way, the incidence of breast and ovarian cancers can be decreased. We also have medical therapy, like there are pills which you can take daily, once in a day, like tamoxifen and raloxifene pills, to decrease the breast cancer risk. Apart from these, lifestyle modifications are very important. So adequate exercise and also taking a good diet, stopping alcohol and quitting smoking, these are the four most important things in the prevention of breast cancer.
And what is the message you have to give to our viewers to prevent the breast cancer?
If I have to give one single message, then never miss your screenings. Screenings save lives, and education is the one important thing where you can protect yourself from different diseases. So this month, October, is all about breast cancer. So we at Al Hilal have ultrasounds and mammograms, and also we have gynae doctors who can help you talk about breast cancer and also discuss about the preventive measures. So come and utilize the month. Not only this month, this talk should be done every year, so women should understand the importance of breast cancer. The main myth is that men don't get breast cancer. It is not. Men have equal incidence in getting breast cancers, and then they say that 1% of breast cancers are seen in men too. So they are also equally prone for BRCA1 and BRCA2 mutations. So men also, if they want to discuss about the breast cancers, they can come, and we do have doctors available.
So thank you, doctor. Thank you for joining us and giving us all the required information about breast cancer.
Thank you very much. I'm really happy to be here.
Thank you once again. So viewers, I hope this was a very informative episode and you got all the required information about breast cancer. For new informative episodes, tune into BMC Global Live Al Hilal Health World every Tuesdays at 8 p.m. Till we meet again next time, this is Jasseela Mujeeb signing off. Good night.